the United States, we're starting to level on the logarithmic phase like Italy did about a week ago. And so this gives us great heart that not only in specific places, but we're starting to see that change. Obviously, a lot of that is driven by the improvement in New York City. Remember, for a long time, they were over 50% of our cases and 50% of our new cases. That has dramatically changed because of the impact of what the citizens of New York and New Jersey Island are doing to really change the course of this pandemic and really change the trajectory of new cases. We're seeing that what many states and metro areas were experienced as twofold and fourfold increases that went to twofold, that now those are going to 8 days between the doubling rate. Watching this every day gives us hope across these metro areas from New York and New Jersey and all through Denver and of course through New Orleans. We still see cases occurring in the Boston area and in Chicago, but their rate of increase seems to be stabilizing. And we really want to call out the work of the mayors of Baltimore and the district and Philadelphia, who have really brought all of their health experts together and working with their communities are starting to really change the curves in those areas. What we're seeing is we're united in social distancing, and that's been very encouraging to all of us, and it should be encouraging to the healthcare providers that are on the front line, many of which are serving our Americans with such dignity and respect and ensuring that everybody gets optimal care. And as the president noted, our mortality in the United States is significantly less than many of the other countries when you correct them for our population. And that is really solely the work of our frontline healthcare providers. And so working with...
Thank you, Mr. President. On March 6th, you said anyone who wants tests can get a test. Now you're saying that you would be open to reopening the government without having a national testing system. How do you square those two statements, given that there's still issues with testing going forward? And how can you tell people
that they're
not
going to have
issues
their
with
lives?
testing?
I got not a lot, and it's a good question. There's not a lot of issues with testing. Certain sections of we go to Iowa, we go to Nebraska, and interestingly, Idaho is very interesting because they had a few breakouts, small breakouts, but they're very, very capable states. They're big distances, a lot of land, a lot of opening. You don't need testing there. You know, where you have a state with a small number of cases, some states with almost none. West Virginia hung in for a... So when you have that, you don't need testing. You don't have to test every person in the state of Iowa, as an example. You don't have to test every single person. There's a little hot corner someplace, we'll be testing. But I think Deborah speaks to this very well. The same thing in New York. That's what we talked to Governor Cuomo about this morning. We have the Abbott test, which is very quick and very easy, goes very fast. Then we have a lesser test that we talked about, where we can talk about a larger area. But you're going to know, so we're going to do testing, but you don't need to test 325 to 350 million people because, number one, it's unnecessary. Vast numbers, vast areas of our country don't need this. I think you agree with me on that. You just don't need it. Now, we have certain hotspots. So Louisiana's a hotspot, New York's a hotspot, Detroit's a hotspot. And then you have certain areas, certain hotspots that you have to even go more so. And we're doing all of that. Remember this, we've done more testing than any country in the world. And we have the best test. And we developed this over a very short period of time. Please.
Can I ask you also about the African-American disparities?
Yes,
I have a question for you and a question for the Surgeon General.
Sure.
For you, Mr. President, we know that these health disparities have existed for a long time among African Americans, Latinos, and other people of color. Why did the administration possibly have a plan directed at those communities to prevent high death rates, knowing that the health disparities were there?
Well, we do have a plan, and one of the things I'm most proud about is what I've been able to do for the African American community. The lowest job numbers in the history of our country. This was
for the virus,
yeah, just before the virus came. Well, I'm just saying, because this has been here for 3 weeks, right? So just before, African American community had the lowest unemployment, the best employment numbers. More African American people and communities have been thriving. If you look at our opportunity zones and what we did, Tim Scott, who's fantastic, a fantastic senator, came to me, opportunity zones, more jobs for African Americans than ever before, better health care than they've ever had before. All of these things. The Surgeon General spoke to it, and he spoke to it, I thought, really brilliantly. I found it very interesting what he said, and love you to come up and answer the second part of her question, because I think you... Please.
Thank you, Mr. Attorney General. Thank you. I have a quick question for you. You said that African Americans and Latinos should avoid alcohol, drugs, and tobacco. You also said do it for your abuela, do it for Big Mama, and Pop Pop. There are some people already
too.
And the idea that you're saying behaviors might be leading to these high death rates. Could you talk about whether or not could you, I guess, have a response for people who might be offended by the language that you used?
Well, I use that language because that's the language I've been meeting negotiation with others. I actually talked with Derek Johnson multiple times this week, the head of the NAACP, and we need targeted outreach to the African American community, and I use the language that is used in my family. I have a Puerto Rican brother-in-law. I call my granddaddy granddaddy. I have relatives who call their grandparents Big Mama. So that was not meant to be offensive. That's the language that we use and that I use, and we need to continue to target our outreach to those communities. It is critically important that they understand it's not just about them, and I was very clear about that. It's not just about what you do, but you also are not helpless. We need to do our part at the federal level. We need people to do their parts at the state level, and we need everyone, black, brown, white, whatever color you are, to follow the president's guidelines, the coronavirus guidelines, and do their part. Because when I talked to the NAACP 3 weeks ago, it's important to note that one of the things they asked me was, can you help dispel the myths in this community that people actually can't get coronavirus if they're black? That was a myth that was out there that's actually very important for us to squash here.
And that all Americans avoid tobacco, alcohol, and drug use at this time?
Absolutely. It's especially important for people who are at risk and with comorbidities, but yes, all Americans. So thank you, and I will clarify that. All Americans need to avoid these substances at all times. I put out a smoking cessation report in January. I put out an advisory against youth and pregnant women using marijuana last year, and that was not directed towards any one race. That's everybody needs to do everything they can to be as healthy as possible at this critical time. Dr. Fauci, would you add anything?
Yeah, I think you said it perfectly. Would you like to add anything to it? Because you are really, you expressed it very beautifully before.
No, I mean, Jerome, you did it beautifully. I can't do it any better than that. And I know Jerome personally, and I can just testify that he made not even a hint of being offensive at all with that comment. I thought that was appropriate. Thanks.
And I can tell you, Jerome has done a fantastic job. Our Surgeon General, I just hope nobody steals him and he goes to one of these big companies for a fortune. Don't leave us, right? Don't leave us, Jerome, please. He's doing a great, you are happy and you're doing a great job. And everybody tells me that too, so we appreciate it.